It's good to see you. I thought I recognized you. So good morning, everyone. My name is Vivian Korthuis. I serve as the Chief Executive Officer for the Association of Village Council Presidents. Our headquarters are located in Bethel, Alaska. Before I continue with my presentation, I'd like to recognize our chairman who is sitting in the audience. His name is Thad Tikyun, and both of us flew in from Bethel, Alaska, early this morning. Chairman, ranking member, and members of the subcommittee, thank you for the opportunity to submit testimony and written statement for the record regarding the Tuahi Initiative and related social services and Indian Child Welfare ICWA program investments that support tribally driven, family-centered services. Tuahi began in 2015 with a simple, practical idea: organize services around families rather than leaving people to navigate disconnected systems. Tuahi has since evolved into a whole-of-government framework. The framework operates at the federal, state, and tribal levels, which helps tribal nations align programs, reduce duplication, fill service gaps, and improve outcomes for children and families. Over the past decade, 6 original pilot tribes helped design, implement, and refine Tuahi, documenting lessons learned and demonstrating the benefits of family-centered coordination across social services, ICWA, and related programs. AVCP is one of the original 6 demonstration sites and was the only site in Alaska with that designation. AVCP is the largest tribal consortium in the nation, serving 56 federally recognized tribes across the Yukon-Kuskokwim Delta in western Alaska. Our tribes are located in 48 villages in a service area roughly the size of the state of New York. Our communities are off-the-road system and accessible only by plane, boat, or seasonal ice, road, or snow machine routes, making service access and any coordination uniquely complex. From 2005 to 2015, AVCP experienced enormous program growth without parallel investment in administrative infrastructure. By 2015, AVCP managed 157 open grant streams, supporting 26 programs, largely siloed by funding source, and with no true organizational infrastructure to sustain integrated service delivery at any scale. This fragmented structure constrained our ability to serve families efficiently, despite the breadth of resources flowing into the region. Tuahi was a turning point. In 2015, AVCP's executive board and key staff developed the Tuahi proposal as a blueprint to change how we operate. Tuahi became the catalyst that enabled AVCP to move from a siloed program model towards a coordinated, family-centered system. Tuahi provided the support and flexibility needed to do the work of organizational transformation, creating a clearing space to evaluate operations end-to-end and rebuild infrastructure that matches the scale of need across our region. Through Tuahi, AVCP designed and built a service delivery model that works for us. Our model works in extreme rural conditions in what I call extreme rural America, and strengthened our ability to braid services. We align multiple funding sources and program delivery so that families experience a clearer, more navigable pathway to receive the services that they need. Tuahi supported AVCP's development of an integrated service delivery model with healthy families at the center, shifting the core question of how do we satisfy the grantor to how do we best service our tribes and tribal members. This shift enabled AVCP to recognize and re-engineer programs into a structured framework that improves access, reduces duplication, and expands services at the village level, not just for our families and children, but for all our clients. We went beyond just focusing on families and children and applied this strategy across all AVCP program delivery to form a strong foundation in which today we stand. Just as importantly, Tawahi helped AVCP build and deploy quality improvement as an operating discipline, supporting phased organizational change, including right-sizing and growing administrative capacity, building a braided division structure, and advancing toward wraparound village-level delivery and community safety. This quality improvement approach allows AVCP to continuously refine how we deliver services across a large remote region while maintaining accountability to tribes and families. Our asks today are three: increase the funding for Tawahi so that demonstration sites have parity with the original pilot sites. Second is to provide resource for continued innovation under the Tawahi model. And third is to preserve Tawahi and make it permanent. While I just have a little bit of time left, I want to say that over the past 10 years at AVCP in Western Alaska, we've experienced many challenges. If we did not have Tawahi funding to really create that service delivery model, that we couldn't even pivot to COVID, to the salmon crash, to the Arctic typhoons, because those are the villages that were hit in our region, and other challenges, including the public safety crisis that we are now experiencing. One of my requests to this committee is to take a look at the GAO report on public safety, PL 280 states, and really take a look at how we can deliver better services to our regions across Alaska. And I want to specify, during the Arctic typhoons in our region, we had 25 villages along the Bering Sea coast that were in the pathway of a second storm that they told us that was coming. Those 25 villages only had 4 village public safety officers. What that means is that there were only 4 incident commanders in those 25 villages. So we are operating at a real desperate situation in our region under PL 280, and we want to take this opportunity to utilize the 35 years of experience of contracting and compacting that the All-Alaska Compact in Healthcare has provided, because as the chairman who left for another meeting said, that tribes learned from contracting and compacting, and we're applying those 35-plus years of experience to other arenas, including emergency response, public safety, family-centered services, and other services that we're developing based on the model that we've created in our region under the Tawahi Demonstration Project. Thank you.